You are listening to Doc Talk Live, brought to you by Dallas Reno Group and Zyga Healthcare Group. We are live in the studio with Dr. Sergio Lugela and Dr. Manhas. The number to the studio again is 972-235-5555, 972-235-5555.
During the commercial break, we took a couple of questions off air, and we would like our experts to address these questions. The first question was from Ms. Ozma, and the question was, does birth control pills cause cancer, and if so, what type of cancer?
Thank you so much. That's a good question. We often wonder about medications that we typically have harmful effects. Birth control pills, there is one suggestion that birth control pills may be associated with certain female cancers like breast cancer and uterus cancer or endometrial cancer. There's no proof that birth control pills actually cause these cancers, so you may continue to take them safely. I'd like to talk about how it may actually be beneficial.
It can be beneficial, and that's right, Dr. Manhas. It can be protective in preventing ovarian cancer, and the rationale behind that is it decreases your total amount of estrogen exposure during your lifetime, and that can be beneficial in preventing ovarian cancer. So if you have a predisposition or a family risk for ovarian cancer, that's something that you need to discuss with your primary care doctor with your next visit.
Excellent. You're listening to Doc Talk Live with Dr. Manhas and Dr. Lugela. The phone number to the studio is 972-235-5555. The second question that we took was from Mr. Durga, and unfortunately his mother passed away approximately 6 months ago. And his question was, how common is renal cell carcinoma or renal cell cancer from which his mother passed away from? And what are the treatment options, if available?
I'm really sorry for your loss, Mr. Durga. But renal cell carcinoma, to answer your question, is not very common. There are about 60,000 cases per year. And the treatment options vary from surgery, if it's a small area of the kidney that's involved, either removing the whole kidney or part of the kidney, and then go all the way to chemotherapy. It just depends on the stage and the number of organs that are involved at the time of diagnosis.
So number to the studio is 972-235-5555. My question is, what if you could elaborate a little bit on breast cancer itself?
So breast cancer is the most common cancer that occurs in women in the United States, and actually also worldwide. This cancer is very effectively treated when detected at early stages, which is why we encourage women to have their mammograms on a regular basis. Family history is also very important. If you have a strong family history of breast cancer, then there is a possibility of breast cancer in your family. And so we especially test to detect whether it's treated. And you may have different screening recommendations. Typically, breast cancer is treated with surgery, removal of part of the breast or the complete breast, and then followed by chemotherapy and possibly radiation.
We're going to take a couple of calls on air. Welcome to Doc Talk Live. What's your health question for our experts?
My understanding is that your mother was diagnosed with stage 3 ovarian cancer, and she has completed part of her treatment, but additional treatment is recommended, correct? Yeah. It all depends on the type of ovarian cancer, and again, ovarian cancer is very difficult to treat. It's difficult to diagnose. We don't have any good screening techniques that are available, so whatever treatment that her oncologist has recommended is probably appropriate. Again, the treatment now for cancer is not stage 3 ovarian cancer and everybody gets treated the same. The treatment now is very person-oriented. It depends on what type of cancer your mom has and exactly what her true stage is. There's different types of ovarian cancers that also determines what your treatment would be. So it's important to discuss all of your concerns with her oncologist and come up with a good treatment plan for your mom.
One of the other thing is we talked about breast cancer. Can you elaborate a little bit about prostate cancer for men?
Prostate cancer is one of the most common cancers in men. A majority of men will develop prostate cancer in their lifetime. That doesn't mean that they'll be diagnosed with prostate cancer in their lifetime. And it's treated, there are multiple modalities for treatment. There is surgery, there's radiation therapy, and then ultimately there's chemotherapy depending on stage. Again, prostate cancer treatment is based on stage. There's also hormone blocking medication that we use to treat prostate cancer. So it all depends on the individual and their stage of diagnosis.
We're going to take a couple more questions. Welcome to Doc Talk Live. What's your health questions for our experts?
Recently, for lung cancer screening, there have been some new guidelines that have come out. The guidelines now state that anybody above the age of 55 who smoked more than 30 years, they recommend a low-dose CT scan at least once every 3 years, in addition to all the other screening guidelines. And obviously, the biggest step that he can do to decrease his risk of developing lung cancer is to stop smoking.
Thank you, Phonesia listeners, for those great questions. We have Sajid from Zyga Healthcare Group in the studio today to discuss what services they provide to patients with cancer. Welcome, Sajid, to the show.
Thank you, Samir. Thank you for having me here. At Zyga, we are a provider of in-home care services to patients who are battling cancer. We send nurses to the patient's house, making sure that they take medications and the symptoms are managed in an appropriate manner. If they have problems, we contact the physician. We try to help the patient and the family as a unit of care. And we understand that families are going through a very tough time battling cancer, and so we try to provide comprehensive psychosocial as well as spiritual and functional services.
Those are some great services that you guys provide. We're approaching the end of our show. Remember to log on to our website, DocTalkLive.com. That's DocTalk live.com, to submit questions for our next week's experts, Dr. Sandhu and Dr. Mishra, who are practicing pain specialists.
That topic is actually going to be a good segue into what we were talking about, controlling pain in cancer patients specifically. We have just a couple of minutes remaining. Dr. Wagela and Dr. Manhas, is there any other information you would like to share with our listeners?
I just want to thank you all for having me on today, and remember that if you have any questions or concerns about cancer or screening guidelines, the first person that you should probably talk to is your primary care doctor, and they'll be able to direct you in the right direction with regards to what you need done with regards to your screening.
Thanks, Dr. Wigan, and thank you also to Phonesia and to the host of the group for allowing us the opportunity to share others' questions. Cancer is a difficult disease to go through, and it's important to be aware of the disease and also potential ways that you can reduce your risk, as well as potential treatment options. So if you have questions, please talk to your primary care doctor.
Once again, thank you, Dr. Wagela and Dr. Manhas, for coming on our show. To all of our listeners, if you need their contact information, please log on to DocTalkLive, DocTalk live.com. That website will also give you contact information for Dallas Renal Group as well as Zyga Healthcare Group. This is Dr. Karim Makadia and Dr. Samir Nangia signing off with another episode of Doc Talk Live. See you next week, same time, same place at 5:30 p.m. Stay healthy, Dallas.